Welcome back to Endometriosis Voices. I'm Isaac Chebafo, and the topic for today's episode is harmful endometriosis myth debunked. Taking a decision with factual information is as important as the decision itself. But in the absence of fact, misconception can quickly fill in the void. In the case of endometriosis, it is evidently clear that myth can be as devastating as the disease itself. Misconceptions can delay diagnosis, block treatment, and leave people feeling dismissed rather than believed. Today, we are bringing together lived experiences of endometriosis sufferers and peer-reviewed science to gently but firmly set the record straight. The first myth that we are going to talk about today is that endometriosis is just a bad period. The tissues found in the endometriosis is similar to, but not identical to, the lining of the uterus, and this is well spelled out in anyone that is scientifically defining what endometriosis is. Studies show that lesions often contain more nerve fibers and can produce estrogen on their own without depending on the ovaries, which can amplify the pain signals that are sent to the central nervous system for interpretation. Endometriosis is chronic inflammatory disease that can drive pain, fatigue, and other symptoms throughout the month, not only during menstruation. Debilitating period pain that stops your work, school, or relationship is never normal, even if it occurs during the menstruation. The next myth that we are going to debunk is that endometriosis only affects the reproductive organs. In reality, lesions have been found on the bowel, bladder, diaphragm, and even the lungs. These lesions can also trigger local and sometimes even systemic inflammation, which is linked with symptoms like crashing fatigue, abdominal bloating, often called endobelly, and immune changes that affect the whole body, not just the reproductive system. If your pain shows up in your gut, your chest, or as a constant exhaustion, it is still real and still deserves investigation. The fourth myth is that endometriosis only affects reproductive age women. We now know it can appear in adolescents, including rare cases even before the first period, and studies have also found lesions in autopsied fetuses. And many adults with endometriosis remember severe period pain and pelvic symptoms in their teens. Endometriosis can also persist after menopause because some lesions are able to generate estrogen locally and remain active even when ovarian hormone levels fall. It should never be used as a reason to dismiss someone's pain or to deny them appropriate care. Myth number 5. If your endometriosis imaging results come out clear, then the pain probably is in your head. This is absolutely not true. If your ultrasound or MRI is normal, but your pain is severe, you are not imagining it. Many small or superficial lesions are invisible on routine imaging, which is why diagnosis requires laparoscopy. And even in the laparoscopy, some endometriosis sufferers have had to do it twice, thrice, sometimes 4 times before the lesions are finally identified. On top of that, central sensitization, where repeated pain signals make the nervous system more sensitive, can turn the volume up on pain over time. This helps explain why some people have little pain despite extensive disease, while others live with life-altering pain even when their lesion looks small. The stage of your disease does not measure the depth of your suffering. I know these 5 myths that I have spoken about in this episode are not exhaustive, and you probably have some more that you want to talk about or even aware of. We'll be happy to learn them in the comment. Myths grow in the dark, often in the silence between appointments, in the gaps in our textbooks, and in the comments people throw at us when they don't understand this disease. Science and shared stories bring light. If you've been told any of these myths, or if you are carrying grief about your periods, your fertility, your body, know that your experience is valid and you are not alone. Thank you for being part of Endometriosis Voices. Please like, subscribe, and if it is safe, share your journey in the comment. We are listening, and together we are pushing for better care, better research, and less suffering for everyone living with endometriosis. Share the page and its content with anyone you think can benefit from its resources. Endometriosis Voices, listening to lived experiences, learning from science.